Employee health and wellness is a big priority for us in McKinsey because we're a people organization. And so, the absolute critical factor to us being able to be effective is having people that are energetic, excited about what they do, and healthy. So it's incumbent on us that we work on that. And if I think about recruiting, we want to ensure that if people believe they come to this organization, they can actually be healthy and productive, and that we do everything we can to encourage that and support them in that. I think that there's a bunch of different challenges in trying to be healthy. One is just, I think the metabolic rate of the world has gone up. It's just busier. There's so many things going on. And when you're busy and you're fragmented and you're running around, I think your diet can suffer. You start eating food to just give you energy. You don't have time to eat properly. There's often not time to exercise. And I think it's vital that you build in, as part of a foundation of whatever you do, your exercise and your eating, or you pay the price, because you tend to get into a vicious cycle. Healthcare seems to be growing at 2 percentage points higher than GDP. So we've got to get our act together. And I also think that there's a lot that we can do in business. This isn't about, well, why don't we point to the system to get it better, or if the government does this or that. I'm sure there are things that can help on that front, but there's a lot actually we can do ourselves. So I think we've got to take a little more control and ownership of that with our own people. I think business leaders should pay attention, or we should pay attention to health and wellness for two main reasons. One is, the health and wellness of our people is what makes us effective or ineffective. If you don't have a healthy workforce, you're not going to be very productive in getting things done. And I think that's the first reason. You're going to be a better, more successful company with healthy employees or people. The second reason, though, is because if you actually look at healthcare costs, and healthcare costs for the average U.S. company in 1960 accounted for about 5% of total compensation. In 2011, it's gone up to 14%. Half of all Americans have at least one chronic condition. So kind of the forces are suggesting this is going to get worse over time. So it's a big issue, and I think we haven't paid enough attention to it as business leaders, and we need to focus on it, and we can make a difference if we do it collectively.